The answer is yes. It does have an impact directly, if you don't mind. For those who want to look at the article, look at Article 348. The right to services in English is in the in the English language is in the Health and Social Services Act, and it's available to all English-speaking persons. That's what it says, and that's been retained. What it changed is it says that right to service is as the services are outlined in access programs for English language services that have to be developed across the province. What's changed is they used to be, up to now, they're prepared locally. The access programs now are prepared centrally. There's going to be one access program for the whole province. Number two, the access programs had to have provisions in there, not only what services are available, but what's your manpower arrangement to ensure that those services are available. That's been removed. What's also been in the law up to now is that institutions that are recognized as bilingual under the Charter of the French language, and the word was designated, so it's somebody who knows the law who asked that question, are designated under 508 of the Health and Social Services Act to provide all of their services in the English language. That's been deleted from the access program section also. So those deletions actually diminish the rights and access to services. They will not indirectly do it, they will do it directly.
All right, so thank you.
Alicia, if I can add, this is an important issue here. What we're talking about is the potential erosion of minority language rights in Quebec in the healthcare sector. And in the Quebec context, we're talking about English language. For many patients who are bilingual, as they reach that point in their lives and they suffer from cancer or dementia, they want to be cared for in their mother tongue, which would be English. So even prior to the tabling of Bill 15, a number of hospitals across the province had expressed concern that the Legault government was showing great insensitivity on this question of access to healthcare services in English in Quebec. There are a number of hospitals that wanted bilingual signage, and that wasn't being respected. Eric Maldoff is absolutely right when he's talking about these access plans that all these various CISs and CSs, they have an Anglophone representative on their board to ensure the drafting and maintenance of access plans, and that all gets centralized under Bill 15 and Santé Quebec. And the Community Health and Social Services Network has raised very serious concerns about that. So going forward, there's a genuine fear that there will be more erosion of access to healthcare services in English, and arguably this is more important when you think about it, people's lives, their illness, than what we've heard about in terms of Bill 96.